This is the rollout phase of the Ebola-resistant behavior change initiative by the Office of the First Lady, which started with a grand launching ceremony in December last year in Freetown. The initiative seeks to engage traditional and cultural establishments across the country for them to take ownership of the fight against Ebola. Traditional and cultural practices have been linked to the continuous spread of the Ebola virus. Therefore, it is important that these practices be avoided to break the chain of transmission of the disease. Kailaun was where the first case was recorded, and like Kenema, they too used to record high cases of new infections and, of course, deaths. Connaught, also in the east, has seen a recent upsurge in new confirmed cases. The First Lady's initiative will create champions within the cultural, traditional and secret societies in the eastern region that will go into their communities and society houses to do surveillance work and discourage any such practice that will hamper efforts to cut off the chain of transmission of the disease. The program support manager Plan Sierra Leone, Miriam Moray, said that Plan is interested in collaborating with people and institutions that want to help bring development to communities, especially for the development of children. Ebola has plagued the nation. Children have been orphaned. More than 2,800 people have died and 9,000 more infected, said Mrs. Moray. Plan is a non-governmental organization, non-biased and not-for-profit. Hence, we will continue to support communities through the First Lady's initiative, she went on. Our country's culture is embedded in secret societies. If one is not a member, you can hardly have access to the society houses where cultural practices take place. Hence, the rationale of engaging those within these structures to take ownership, engage themselves, and stop traditional and cultural practices. The District Medical Officer, Kenema District, Dr. Mohammed Vande, says that the First Lady's initiative is in line with the district's planned activities, which is to engage culture and tradition in getting to zero Ebola infection.
We shall come out where the caseload be high, with the aim of 10, 15, 20 per day. Now we don't come with the A1 for the month. Now Kenema refer to 1 to 4 a month. We don't come out far. But that fact at that time, it be tedious. This one we don't left, it's not easy.
He made a detailed presentation talking about the Ebola triangle, surveillance and of course culture and tradition, the key to breaking the chain. In her keynote address, the First Lady, Sianya Makroma, said that the health system in the West African sub-region was not prepared for an outbreak of the disease like Ebola. She said that the country has been affected in several ways. Children are not going to school, nurses and doctors are dying, and children have also been orphaned. She said that she has been informed that teenage pregnancy is on the rise in Mile 91 and in the Moyamba district. The First Lady said that Sierra Leoneans must promote safe hygiene practices.
What we don't start off with, so now part of the conference, in order also the Ebola get good points and bad points. And some of the good points, some attributes we don't left, we don't get so, we left with some. Salon they can be a society. Will for continue for promote hand washing. Whether you ask out Dettol, disinfectant, soap and water, all hand washing and personal hygiene are the same.
The First Lady said that traditional healers have in the past worked closely with her office. She told them that she has not come to attack them, but to empower them.
Through Plan International, we get a program we call Engaging Traditional and Cultural Establishments in Ebola Response. This way I not come by mistake.
She encouraged them to take ownership in the fight against Ebola, telling them that Ebola is a viral disease that cannot be healed by herbalists.
The international world said we say Salon and Guinea, they lag behind by the Ebola response. So then targets we say Australians, let them take the call beyond bodily contact. That shake. Let them challenge the secret societies because we know say they hold the secret society in high esteem, but then involved in a lot of things like washing of the dead, touching of the dead, when they continue what we call the train of transmission.
Also present was the minority leader in the House of Parliament, Honorable Dr. Bernadette Lahai, the resident Minister East, Honorable Maya Kaikai, and several other dignitaries. The First Lady also made a presentation of medical items to the Kenema District Ebola Task Force. She visited the Ebola epicenter in Kenema, where she was briefed on the constraints facing the facility. Kojo Kwafo, SLBC.